But have you noticed that when we're designing hospitals or we're designing clinics, it seems as if we design them of where the cables need to run and the bed needs to fit versus for the human-to-human interaction? And what have you seen in the design world around, maybe I'll step back. When we design homes, an architect will ask us, what are the themes of your home? I want it to be a soft, warm place. I want it to be a gathering place. I want conversations to happen. I don't know that we ask that necessarily about design of physical structures in healthcare. What have you seen that inspires you to say, okay, we're headed in the right direction? Human-to-human design.
Well, I think the only way to do that is to involve, as you're going to hear from Michael, the patient and the doctors and nurses in that design process. And I think historically, they've been left out of that. I think they have the engineers, the architects, the building operators, and then they ask the doctors, nurses, and patients to come in and bless what they've already plotted out. And the train is already moved and it's off the track. And if you don't step back, and the first question you ask of patients and doctors and nurses is, how do we create a sanctuary for healing? And what do you need to be whole as a doctor or nurse? And what do you need to be whole as a patient? What will enhance your healing? Then we're never going to get there in healthcare. So without you building a center that designs for people, we're not going to get there. And we need it now. Healthcare is still so broken. And I have hope because you exist at Intermountain.
That's so kind of you. A lot of people don't know that Procter & Gamble has a program called Living It. They will literally go into your home and live with you to watch you do laundry or floors or windows, all for the point of designing a product that you would love to hire, that you would love to use. They do this. Scott Cook, the founder of Intuit, has a program called Catalyst. 800 of his 8,000 member team are trained in contextual inquiry, ethnography. They'll sit around your table and do taxes with you if you do it, or they'll do payroll. They'll ride on the back of a Harley to deliver pizzas with a pizza shop owner. Why do you think it's taking so much time? If it's important enough for soap, frankly, and for payroll, which is important, I'm not saying they're not, but why do you think it's taking us this long in healthcare to get to that passionate level of removing friction points for the people who we really are trying to care for?
Well, you're going to hear from Michael on how to do this and why, but I believe it's shame on us in healthcare that we waited until the government mandated that we measure, publicly report, and tie money to the patient experience. So number one, that's why many are starting to do it now. But second, this generation of patient consumers is not our parents or our grandparents, and they will not settle for this, and they will choose an institution that delivers both competence and compassion, and they can walk with their dollars. So I think systems that are sitting back and leaving these antiquated processes and structures in place will lose in the end, because I think the only way to drive growth and loyalty is to create an emotional connection and design an environment and an ecosystem that connects intimately with your patients before they arrive in the doors of your clinic or hospital, and stays connected after they leave, and creates a healing environment when they're there. From the patient gown to parking to the technology that enables them to communicate with their doctor. It's easier to reach your car salesman or your vet than to reach a doctor or nurse after discharge. That's crazy. But when you embed a patient in the design process, you can fix those things overnight. These are hackathons that you can do in a weekend and have them hardwired by Monday. These things should not take 6 months to a year to get up and running. And the number one greatest obstacle, you may ask me, are typically have been doctors or nurses that are slow to adopt, because we haven't engaged them into the design process. We inflict the solution on them when it's already hatched. So bring them in early and partner them with patients.